Postoperative delirium, or POD, may occur in patients after surgery, and it becomes more common as patients get older. Symptoms can include inattention, memory issues, confusion, hallucinations, and sleep disturbance. Postoperative delirium may be reduced through early identification of high-risk patients. Common risk factors for developing postoperative delirium include advanced age, frailty, mild cognitive impairment, dementia such as Alzheimer's, alcohol use, smoking, and some medications, including psychotropic medications. All members of the perioperative team, including nurses, surgeons, and anesthesiologists, have a shared responsibility for identifying and reducing the occurrence of postoperative delirium. Ensure early discussion and ongoing involvement with the patient and their support person to address concerns and questions. Consider using screening tools such as the Clinical Frailty Scale, Edmonton Frailty Scale, CAM-ICU, the Confusion Assessment Method, ICU, or other frailty or cognitive screens to identify high-risk patients before they come for surgery. If appropriate, consider referral to a geriatrician or other physician with geriatric expertise for patient optimization prior to surgery or upon arrival to the post-anesthetic care unit, or on the ward after surgery. When choosing an anesthetic that is best suited for your individual patient, consider the use of intraoperative EEG monitoring to minimize the chance of over-anesthetizing your patient. Consider using multimodal and opioid-sparing analgesia, such as dexmedetomidine, to minimize cognitive effects. Avoid the use of benzodiazepines and agents with anticholinergic properties. Strongly consider early reorientation and providing of sensory aids in PACU. Ensure early discussion and ongoing involvement with the patient support person to support the patient and address concerns and questions. To support reorientation to time and place, ensure sensory aids like hearing aids or eyeglasses are returned to the patient and use visual cues in the environment. Encourage the patient support person to notify a healthcare provider if they are concerned about a change in mental status. Encourage the patient support person to bring any additional personal items as soon as possible, such as a tablet or photos. Utilize the Confusion Assessment Method CAM-ICU screening tool for delirium in PACU and on the ward. Contact the attending physician to complete appropriate delirium workup if warranted. If necessary, use antipsychotics with low anticholinergic properties in low doses for management for as short a time as possible. Consider consultation with a geriatrician, geriatric psychiatrist, or other health professionals for patients with ongoing symptoms.